Hi, my name is Leslie Zindolka, and I'm a licensed clinical social worker, proud adoptive parent, and one of the many instructors for AdoptionEducationClasses.com. Today I'm here to speak to you about what to expect when arriving home with the internationally adopted child. Before we begin, I'd like to talk about some food for thought. Children of adoption are just as normal as any other children. International adoption is just another way to form a family. Although adopting a child of another race is not for everyone. We must put adoption in the context of the modern family. This will help normalize adoption because there are no more traditional families of a mom, dad, 2.5 children, and the white picket fence. Today, families are made up of divorced, single, gay, biracial, not married partners, grandparents raising grandchildren. And it takes an especially sensitive parent to raise a child of a different race in our race-conscious society. When adopting internationally, there are a few variables to consider. The type of care. Is your child coming from a foster home care setting, or are they coming from an orphanage care setting? The age at which your child comes home. Your comfort level with transracial adoption. Keep in mind that children are placed into care due to poverty, abandonment, parental substance abuse, or neglect. The birth parents' medical histories are not always known, especially for abandoned children. And certain health risks are inherent when adopting internationally, such as malnutrition, parasites, hepatitis, and developmental delays. Generally, though, the more opportunities your child will have for physical contact, models of affection, language models, and stimulation, the better the outcome for your child, regardless of the type of care they lived in prior to their adoption or either of your races. There are orphanage care issues to consider. Your child may have had little or no prenatal care, may have never had immunizations, and they may suffer from malnutrition prior to placement. Children are also affected by living in an institution during critical developmental periods of their life. Therefore, for orphanage children, the age at placement into the orphanage and the duration of the time spent in the institution are critical factors. Some children have lived in an orphanage since their birth, and others are placed into care as an older child, having lived with their biological family for the first few years of their life. Stereotypically, infants and children in an orphanage usually receive less than adequate overall care. They'll have fewer chances for stimulation, poor nutrition, and little health care. Many children are not held when they are sick, so they learn not to cry. They are given medication to keep them quiet, and many even share toothbrushes. They'll have fewer opportunities to explore their environment and for social interactions. Infants in orphanage care usually arrive home between 9 and 20 months old, and this is considered a shorter time in care. Now, if all of the environmental variables are positive, and a child spends a minimal amount of time in an orphanage environment, and has strong survival skills, that child will have a decent chance of reducing any developmental gaps that they will come home with. There are issues with foster home care as well. Infants in foster care live with a host family and receive family-like care, not like you or I would treat it and care for a child, but family-like care. Foster care is typically short-term, and the children will usually arrive home between 3 and 9 months of age. Arriving home at this young age and living in foster care enables them a better chance of successfully attaching and bonding once being placed with their adoptive parents. Now, physicians who evaluate video and medical referrals and or examine children coming home from orphanages estimate that 1 month of cognitive and physical growth is lost for every 3 to 4 months spent in institutional care. And this is called institutional growth delay. Basically, the longer the child is in any type of temporary care, the higher the risk of post-institutional effects when they arrive home, such as poor attachment, problems with bonding, language delays, health issues, and school readiness concerns. There are transracial adoption issues to consider as well, because now you're an interracial family. Do you have preconceived judgments about certain races? How do you feel about the public attention or stares and questions you will naturally get?